Morning, how are you? Wish you are fine. If you want to have an inquiry about the protocol for hemifacial spasm, here it is. Let us speak about
This is a tutorial
hemifacial
on the
spasm.
muscles of the face,
Contrary
so the
to
muscles
Bell's
responsible for
palsy,
facial
hemifacial
expression.
spasms are often
So these
caused by
muscles are
irritation
innervated
or
by the
damage
seventh
to your
cranial nerve,
facial
the facial
nerve.
nerve.
They are commonly
So
caused by a
when you're
blood
testing
vessel
a patient's cranial nerves and you
rupturing
get to cranial nerve
on the
number 7,
facial nerve
you
near
ask them to
where the
wrinkle their
nerve
forehead,
connects to the
to close their
brainstem.
eyes as tightly as they can,
When this
to
happens, the
show you their
facial nerve
teeth by
may
making a
act on
smile,
its own,
and
sending
asking them
out
to
nerve
puff their cheeks
signals
out.
that cause
So this is
facial
a crude
muscles
test of the muscles of
to
facial expression.
twitch.
So the way I'm
This
going to
is
do
known
this
as
tutorial is
an
that I'm going to start
hepatic
superiorly
transmission,
and work
and
through
it's one of the
the
main
the
cause
various
of this
muscle groups in the
spasm.
face. So the
When applying pressure,
orbital muscle group, the
SG
nasal muscle group,
17 on the affected
and then
side,
the
patients
muscles
will likely
in
to
the
report
oral
soreness
region.
or worsening of
So to begin
symptoms.
with,
In mild
looking at the
cases,
most
this
superior
condition
muscle on the face,
can be
you can
relieved
see
by
this muscle here,
SU
which is the frontal belly
17 and
of the
C1, C4,
occipitofrontalis muscle.
GJ
And
points
it's called
with
the
reducing
occipitofrontalis muscle because it
methods.
consists of two
Moxa or
muscle
warm
bellies.
needling
So
to
you've got the
above
occipital
points. Soft
muscle
tissue
belly,
massage release to the
so called because it's on the
suboccipital region.
occipital
Vitamin
region of the
D,
skull,
magnesium, which you
and
can
you've got
get
the
from almonds
frontal
and bananas.
belly of the
Chamomile, which is
occipitofrontalis.
available as a
And
tea
connecting these
or
two muscle
as
bellies, you've
tablet.
got this
Blueberries, which
flat
contain
tendon
muscle
sheath, this
relaxing
aponeurosis.
antioxidants. So,
Um,
according to that,
and if you've covered the layers of the scalp, you'll have been told that the aponeurosis of the occipitofrontalis makes up the third layer of the scalp. So you've got skin, connective tissue, aponeurosis, loose connective tissue, and then the periosteum.
Magnesium is available
So the aponeurosis
in
of the
almonds and bananas.
occipitofrontalis
You can take it as tablets or as
is the third layer of the scalp.
blueberries, which contain
So
muscle relaxing
if we just look at the
antioxidants. So in
orbital
general,
region,
if you want
we
to
can
know
see
more,
these
which one of
muscles
them
which surround
is more
the eye,
suitable for you more than the
and
others.
this muscle is called the
Follow
orbicularis
the
oculi,
videos which I made
and it's
about
acts sort of
blood
as a
type
sphincter of the
and
eye,
suitable
and you've got an
food
outer
which is
part
related to your blood type.
and an inner part to
If
this
all
muscle.
of the above doesn't help, patient may need to
So
be
this
referred
outer
to other
part here
treatments such as
is called the
Botox
orbital
or
part,
surgery. Because of that,
and it's
I
responsible
have
for closing the
a lot
eyelids
of courses
forcefully.
about hemifacial
If I
palsy,
just zoom in a little bit more,
which I use Botox
you
to
can
treat
see
them,
that
and you will feel
inner
that there is
part
difference between
of the orbicularis oculi,
difference
and
or
this is called the
good
palpable
result
part,
between
and it resides
80
inside the
to
eyelid,
90
and it's
maybe
responsible
more.
for
If you
closing
like
the
this
eyelid
video,
gently.
please make like, share, subscribe
So
to
that's
my
the orbicularis
YouTube
oculi,
channel.
this circular muscle
Good
responsible for
morning,
closing
how are
the
you? Wish you are
closing the
fine.
eyelids.
I'm Dr. Bassem, I'm plastic
So the
surgeon.
next
I want
muscle
to speak about
is this muscle
Bell's
here,
palsy.
the corrugator
Bell's
supercilii,
palsy.
and
What
it lies
is
just
Bell's palsy?
deep to the
It's a form of
orbicularis
facial
oculi,
paralysis due
and it draws the
to
eyebrows
dysfunction
medially and
of
downward.
the cranial nerve, the sevens.
There are
facial
three
nerve,
muscles
causing an
associated with the
inability to control facial
nasal
muscles on the affected
muscles
side.
of the
Often,
face
the eye
in the
on
nasal
the
group.
affected side can't be
So you've got the
used.
procerus,
What are the causes?
you've got the
Infection,
nasalis,
trauma,
which consists of a
surgery,
transverse
any
part
pressure on the nerve
and
due
an
to any reason.
alar part,
The common
and you've got this
presentation
muscle
of
in the
this
midline,
condition is a
which is
rapid
called the
onset
depressor
of
septi
partial or
nasi.
complete paralysis that often
So the
occurs
procerus muscle
overnight.
here on either side
In rare
originates
cases,
on the nasal bone
less
and
than
inserts onto the
1%. It can occur
skin
on both
of the
sides,
forehead,
resulting
and this
in
muscle
total
is active when
facial
an individual frowns.
paralysis, which is rare, less than 1%. Treatment.
And these muscles here, the nasalis, which consists of the transverse part and the alar part, is responsible for compressing and flaring the nostrils, the nares. So the transverse part compresses the nostrils, and the alar part,
one hand on each side
the alar
of the
part
face.
of the nasalis, helps to flare the nostrils. It opens them out.
And the other hand
And
is
this
pushing
muscle here, the
downward
depressor
as
septi
if
nasi,
it is
So the name kind of gives away what it does. It depresses the nasal septum, so it draws the nose down inferiorly. So it actually inserts onto the nasal septum, and it assists the alar part of the nasalis in widening the nostrils. So those are the three muscles of the nasal group of the facial muscles: the procerus, the nasalis, and the depressor nasi septi.
Slide the hands gently on the face to the starting position.
So the next group of muscles is the oral group of muscles, and as you can see, there's quite a lot of muscles which make up this group. So if you're not interested in learning about all those in detail, then I'll just cover the two muscles that you need to know, and you can switch off after that, and then if you're interested you can carry on listening to find out about the other muscles. So what you need to know in the oral group, if you're only going to learn two muscles, is that there's this big muscle here which forms a circle around the mouth, and this is known as the orbicularis oris. So just like you've got the circular muscles around the eyes which constrict around the eyes, the orbicularis oculi, you've got the orbicularis oris. So in Latin, oculus is an eye, and os, oris, is a mouth, so orifice, oris, help you to remember that. So orbicularis oris, this circular muscle which circles the mouth. And you can kind of guess what the function is. When it contracts, it narrows the mouth and closes the lips. So you get this pursing action, which you get when you're whistling, and that's brought about by this muscle, the orbicularis oris. And the other muscle you'll need to know, which lies deep to these muscles here, is the...
Hold 3 seconds for each exercise you do. The more you exercise, the better outcome and find. I'm speaking in general about the hemifacial palsy and bells, because I use Botox to relax the muscles, and as I told before that the patients get good result. It is as percentage between 80 to 90. If you like the video, please make like, share, subscribe to my YouTube channel. Good morning, how are you? Wish you are fine. I'm Dr. Bassem Sulaiman. I'm plastic surgeon. I want to speak about the 7th nerve, the facial nerve, which is the 7th pairing of cranial nerves. They arise from the lower part of the pons at the base of the brain stem and emerge on the sides of the face. Their sensory branches are associated with taste receptors on the front 2/3 of the tongue, and some of the motor fibers send impulses to muscles for facial expressions. Other fibers function involuntarily by stimulating the tear gland and some saliva glands. The facial nerves from the brow to the throat under the chin include the temporal nerve, which is here, the temporal nerve, the zygomatic nerve, the buccal nerve, the temporal nerve, the zygomatic nerve, the buccal nerve, and the mandibular nerve, and the cervical nerve. In general, I'm trying to put or to speak about some of the anatomy which are important when we want to make Botox or fillers. That's all about this video and the facial nerve. If you like this video, please make like, share, subscribe to my YouTube channel. Good morning, how are you? Wish you are fine. Dr. Bassem, I'm plastic surgeon. I want to speak about Botox and muscles of facial expression. Facial expression is one or more motions or positions of the muscles beneath the skin of the face. In general, if we want to speak about the muscles of facial expression, you should know, or did you know that your face is the only part of the body where the skin is attached to the muscles? The skeletal muscles of the face are different from the skeletal muscles of the rest of your body. In your face, many of the skeletal muscles attach directly to the skin or to other skeletal muscles, not to tendons or bones. This means that a tiny contraction is one of the facial muscles will pull the skin of your face and therefore change your expression. Because of this unique feature, you can produce countless different expressions, from grinning to smiling, winking, grimacing, raising an eyebrow, and so on. In general, I may add a lot of videos about muscles of facial expression. If you like the video, please like, share, and subscribe to my YouTube channel. Now we are continuing talking about the muscles of facial expression. Depressor muscles, levator muscles, and sphincter muscles are all present in the face. This image shows a great depiction of the directional pull of these muscles. Over time, due to contraction of facial expressions, fine lines, wrinkles become static, setting into the skin. Anti-wrinkle treatments can stop these lines and act as a preventative tool. In general, let us continue to speak about Botox. How Botox works. Botox is injected with a very fine needle into specific muscles on the face. This is why a skilled injector with advanced understanding of facial anatomy and musculature is so important. The active ingredients in Botox or Dysport or Jouvou blocks the signals from the nerves to the muscles. The injected muscle has diminished movement, which cause the wrinkles to relax and soften. The effects of Botox will last 3 to 6 months as muscle action gradually returns. The lines and wrinkles begin to reappear and wrinkles need to be retreated. The lines and wrinkles often appear less severe with time because the muscles are being trained to relax. Our medical team has been trained in advanced techniques to give you a best result possible. In general, the consultation for Botox in general, it is free. Botox works by preventing the facial nerve. The nerve of facial expressions, the facial nerve is the nerve of facial expression. All our numerous facial expressions result from the contraction of subcutaneous muscles. They move the skin and change facial expressions to convey mood. The facial nerve innervates all the superficial muscles of the face and the scalp. Voluntary motor signals derive from the motor cortex. However, a large part of facial expressions is involuntary and escapes the control of the superior centers. In all cultures, the face expresses a range of fundamental emotions: anger, pain, and disgust, attention, contempt, fear, joy, sadness, surprise, and or astonishment. Even people who are blind from birth produce these same expressions. It would seem that these emotional manifestations are not simply acquired but are innate. In general, let us continue about speaking about the muscles, the anatomy, muscles, nerves, and all about muscles of facial expressions. So muscles of the human face and neck highly important for non-verbal communication, which helps show emotion. Humans have well developed muscles in the face that permit a large variety of facial expressions because the muscles are used to show surprise, disgust, anger, fear, and other emotions. They are an important means of nonverbal communication. Muscles of facial expression include frontalis, orbicularis, oris, laris oculi, buccinator, and zygomaticus. That's all. Let us continue in another video. How are you? Wish you are fine. I will post a picture which shows the French physiologist Guillaume Benjamin Deschonay during one of his experiments on living objects. He studied various facial muscles using an electric current through electrodes on the face. We couldn't find the name of the photographer. So, muscles of facial expression supplied by the facial nerve are attached to and move the skin of the face, producing many facial expressions. Daily movements like smiling, frowning, and chewing give your facial muscles a major workout. And just like your body benefits from a good rub down after a hard sweat session, your face benefits greatly from a massage as well. So, muscles of facial expression form groups around the orifices and act as sphincters and dilators. The purpose of the facial muscles is to control these orifices. The varying expressions so produced on the face are side effects. In general, I may put some videos to show the muscles of facial expression. So the muscles of the face are fascinating to look at. They are different than skeletal muscles which attach to bone. Facial muscles attach to other muscles or to the skin. This allows for a broad range of expressions in the face. Face massage is so important for helping with overall skin health. Estheticians are trained to release muscle tension, which move the blood through the oxygenates, clearing away stagnation and enveloping the cells. Proper massage can also produce less movement of wrinkles and can also reduce wrinkles, depth, and sculpt the face for a smoother, younger look. Did you know that you can exercise your facial muscles just like you can exercise the muscles in your body? Not only does microcurrent work down in the cellular level of the skin to stimulate new collagen elastin, it actually goes deeper and stimulates the muscles. It uses a controlled low-level electric current to help tighten and tone facial muscles. The skeletal muscles of the face are different from the skeletal muscles that make up the rest of your body. In your face, many of the muscles attach directly to the skin or to the other skeletal muscles, not to tendons or bones. This means that a tiny contraction in one of the facial muscles will pull the skin of your face and therefore changes your expression. Because of this unique feature, we are able to make countless different expressions. This is also why microcurrent can produce noticeable results after just one treatment. By tightening certain muscles, we lift the skin. So, according to facial slimming, jawline injections, anti-wrinkle injections can be used to slim the face when injected into the angle of the jaw, the masseter muscles. By using Botox in the jaw area, anti-wrinkle injections can slim prominent jawlines and create a more aesthetically pleasing facial contour. It lasts 4 to 6 months on average, although this depends on the individual to a certain extent. Moreover, this is a fantastic way to stop bruxism or teeth grinding, and indeed it is often those patients with larger masseter muscles who suffer from this. It's why they are far bigger than normal and therefore cause bulk to the lower face. This was performed by a lot of doctors, and you can see some of my pictures about Botox which is injected in the masseter. In general, that's all about the muscles of facial expression. If you like the video, please like, share, subscribe to my YouTube channel.